Thank you so much, Sahanji, from joining Palestine. And again, a possibility and opportunity for RESO platform to have people like you from different domains and expertise. And it's always good for the expansion of academia and research. And you are a medical freelancer with a qualified medical degree and BBS from Alexandria University. And your country is Palestinian, a good country. So thank you so much again once, to have you on this platform. And just wanna talk. The topic is kind of blend. It's very important topic about medical science and public health and human trafficking, human rights, and interconnectivity. So very much glad to have you on this platform, ma'am. Thank you so much for joining. So would like to start the conversation with my first question. It says how can healthcare professionals contribute to combating human trafficking through early detection and medical reporting?
First thing, I would like to thank you for hosting me. It's just an honor for me. Regarding the question, and as we all know, that healthcare professionals are often among the few people that are dealing with this trafficking victims, okay, in a safe environment. So, by the healthcare professionals are trained to detect the red flags like unexplained injuries, maybe some unknown identification, lack of identification, fear feel like he's in fear or in control by by another person. Okay, so what is the keyword here? The keyword for these victims and is the medical reporting. We need to implement a trauma-informed, safe protocols for medical reporting. Okay, so we can keep these victims.
Responding this question was certainly important, and knowing the interconnectivity combating human trafficking. Would like to move on to my second question. A very important question says, what ethical dilemmas do physicians face when treating victims of violence or human rights abuses?
Well, as a physician, we face a conflict between maintaining patient confidentiality and the duty to report abuse. Okay, so in some cases, victims may fear retaliation or legal consequences. Okay, and there's another dilemma involves obtaining informed consent when a patient is traumatized. So we can't get the consent from the patient when he's traumatized. We can't get the consent from the patient if he's under the pressure from another person. Okay, there's another thing, and I feel it's a personal feeling as a physician. We can't be neutral. Okay, we can't be neutral when these things happens to our patients. Okay, that's it for this question.
Important, like how to handle ethical dilemmas as physician, because as physicians you face tremendous varieties of problems. They may be ethical, they may be practical, they may be some sort of any concern and dangerous things. So would like to move on to my third question. Important question is, in what ways can we promote anti-corruption practices within healthcare systems to ensure fair and equal access to care?
I am from Palestine, which is a low-income country, and I lived in Egypt, which is also a low-income country. And corruption is a very serious problem in these countries. Okay, so there's a lot of ways to do anti-corruption in these countries, like maybe do digital things. Maybe you need to do a digital system. You need to adopt a digital system to buy medical supplies, so there's no cheating. Also, we need to focus on transparency and accountability. There's something and there's a topic which is a very important topic, and it's audits. Okay, you need to check and you need to make sure that every step in the health system is under control by some persons. For example, the doctors themselves need to do regular audits in their department, okay, in the hospital, and etc.
you so much letting us know like how to handle anti-corruption practices in the health system and medical setup. So would like to move on to my fourth question. A very important question says, what is the role of medical researchers in influencing public health policy and social reforms?
Medical research is a very important topic that I would like to talk about because for me, I'm a GP looking for research field and research opportunities, but I can't find them because of what? Because the people and the GPs, the doctors, the physicians are not aware of how important the medical research is. Because medical researchers do the researches in diseases, in epidemiology, in a lot of things that help our community. Okay, they also give important decisions to the government themselves because as we face coronavirus, okay, into 2020, okay, and it was a very serious condition that we need to collect our power to face this pandemic. So medical research is very important to to have some resolution for the problems before the problem come in.
So much letting us know on the importance of medical research and how it influences the very system of medical setup. I would like to move on to my fifth question, which is also a wrap-up question. It says, how should healthcare systems respond to climate change and humanitarian crisis, especially in fragile regions?
I think that healthcare professionals need to be trained for crisis, for emergencies, so they can do their work, even in emergencies. Okay, so there, for example, we need to adopt digital services so we can reach out to the people in remote or to the people that we can't go for them personally. Okay. Maybe we as healthcare professionals also use eco-friendly practices and support policies that protect people's health from the effect of climate change in the long run. Okay, and that's it.
Mhm.
I like to give just a short answers because I think it's easy to understand.
Thank you so much, Selvanji, from joining from Palestine. And you've talked about the great detail of medical science, public health, climatological concerns, human trafficking, human rights, and its violations, how it impacts the very medical system. Like you talked about healthcare professionals contributing and combating trafficking through early detections and medical reporting, what ethical dilemmas physicians face and their consequences, in what ways promote anti-corruption practices in health systems and health environs, what's the role of medical research influencing the overall structure of medical setups and all. And you finally talked about healthcare systems responding to climate crisis. You also used science saying like eco-friendly practices, very important from a research point of view, from academic point of view, very, very important concepts you talked about. Thank you so much, ma'am, joining and giving your precious time and appearing on the platform of Resource.